and let it go. There it goes, that's the one I wanted. Hello Baltimore, it's Dr. Jeff Kalkstein with Kalkstein Chiropractic, your Baltimore area chiropractor, and I'm with Jaden today. We've got a special guest. Jaden goes to the Naval Academy, you're a junior? What do they call juniors?
Second class.
Second class, yeah. And he's off today because of Martin Luther King,
yes,
right?
That's right.
Also Groundhog Day and Inauguration Day, so a big day today, a lot of stuff going on, right?
Big day.
So, so Jaden, what brought you to see us?
I was having some neck pain. I tweaked my neck a couple days ago, and last night I was just kind of couldn't really sleep.
So I should interject here. Jaden is on the wrestling team at the Naval Academy, and you felt you were wrestling?
Yeah. Just felt kind of weird afterwards. Nothing too crazy. Just felt it last night mainly.
And how many days ago was that?
That was like 2 days ago.
Yeah. How'd you find us?
So I looked on Yelp last night, and I was just trying to find a chiropractor, and I saw you guys had the best reviews, and you were pretty close by.
Close by, yeah.
Just gave you guys a call.
And you went to a chiropractor he's from California, by the way. You went to a chiropractor back there?
Yeah, I did.
Yeah. You were on the wrestling team then?
Yes.
Yeah. So we brought him in, and we checked his range of motion. It's restricted going to the right. He didn't like bending his head backwards. So after we examined him, we did some trigger point dry needling, and we did some class 4 laser on the right side of his neck, because that's the involved side. How does it feel after that treatment?
It feels a lot better.
A lot better, yeah. So go ahead and look at Carly. Go ahead and turn your head to the left. Yeah. Any discomfort when you do that?
No.
No, go to the right for me. Any discomfort there when you do that?
Just a little bit.
A little bit, yeah. So do the same thing. Look up at the ceiling, bend your head back. Does that bother you as much as it did?
No, not as much.
Now look over, go back again and look over towards me. Go back and look over towards me. Does that still bother you at all?
Just a
A little bit, yeah, okay, all right. Let's get you up on the table, so you're gonna lie on your back for me, Jade.
All right.
So I was telling, so Jaden walked on to the wrestling team. Did you walk on as a freshman?
Yeah.
So you've been on it for 3 years.
Yeah.
What's your weight class?
125.
125. Do you have to cut weight to get there?
Yeah.
Really?
Yeah.
Is that painful?
It's all right. It's just part of the job.
I had to do that when I was younger with football. I think it was like either, wasn't Mighty Mice, or no, it was Mighty Mice or midgets. You got to a certain level, you had to weigh X number of pounds, and I was bigger for my age at that time, and I think I stopped growing when I got into like 8th grade or something like that.
Okay.
So you've been adjusted before, right?
Yes.
Yeah. I have. So I want you to just relax for me, this way. And I just want you to let your head sit into that cushion for me. You okay with that?
Yeah.
Let the table bring you up. Let's have you flip over on your back. When you get back to school, you should go see one of the trainers, okay?
All right. Yeah. Well, we have a trainer on. Make sure you know.
Is he specifically for your team?
Yeah.
Yeah, and I asked Jaden, do you know if you have a chiropractor?
There's no chiropractor at school.
Yeah, I used to know the guy that covered for the academy for a while. I don't know what happened to him. Slide up for me, and let your arms drop down for me, and just relax. So again, you know, what I'm looking for are those areas that are not moving very well. Take a deep breath in, Jaden, and let it all the way out. Beautiful. So I'm looking for those areas that are stuck or not moving as well as they should. Again, deep breath in and let it go. There it goes, that's the one I wanted. Stand up for me. Go ahead and step off. And go ahead and face Carly again. Let me see you turn your head to the left. How's that feel?
Feels good.
Yeah, go back to the right now for me. How's that feel?
Feels good.
Feel better than it did before I adjusted you?
Yeah, definitely better.
Yeah, it probably what happens is you have hinges that allow movement to occur in your neck. They're called facet joints, right?
Yeah.
And the facet joints have nerve endings that go to them. It's a nerve comes off. It's called the medial branch of the dorsal rami. So when the facet joint gets locked up or tweaked, right, it starts to fire that nerve ending, and it sends signals to your brain that says, hey, I don't like this down here, and you start to get a little bit of pain, and your body starts to compensate, you lose some motion. So there's one exercise I really like for neck issues. It's called, it's a McKenzie cervical spine translation, and basically you'll know this. Remember when that you used to have to brace up and do how many days till Navy beat Army, what the movie was? So the brace up is basically called chin translation. I want you to take your chin and pull it in like this, right? And let it go. Bring it back in again. 1001, 1002, let it go. Do it again. Perfect. Let it go. And one more time. Let it go. So you'd want to do 10 of those a couple times, right? Yeah. And because you study so much at the Naval Academy, you want to bring your book up like this so you're not looking down all day. It'll take stress off that neck of yours, okay? All right? And when you get back, go see your trainer, okay? All righty?
Yeah. Thank you.
My pleasure. Thank you, Baltimore. I know, Carly, I'm supposed to say something after this. If you like this video, what are we supposed to do?
Like and subscribe.
Like and subscribe. What else? If you're having neck pain, heaven forbid, come and see us. Thank you, Baltimore. Thank you, Jaden.
Of course.
Good. Hello, Baltimore. It's Dr. Jeff Kalkstein with Kalkstein Chiropractic, your Baltimore area chiropractor. And I'm with Alicia this morning. And what is unique about this young lady is, where do you live?
I live in Upper Marlboro.
Upper Marlboro, yeah. So how long did it take you to get from Upper Marlboro to Towson on a good day?
On a good day, an hour.
An hour, okay, all right. And so you first came, I've got the history right here, you first came in like 2020.
Yeah.
And what brought you in then?
TMJ.
TMJ, yeah. And did we have good results with that?
Yeah. So if I wouldn't have done this, I went to the dentist. They gave me a mouth guard, they wanted to give me Botox, they wanted to do all these things.
Right.
And at the time, my situation was getting progressively worse, and I mean, I don't need Botox. So,
yeah. So and she came about 6 or so times, and during that time we did what to help you? We did...
I started off with adjustments,
Right.
and then that was an instant thing. And then I received acupuncture.
So what you received was trigger point dry needling. We're not acupuncturists, but as chiropractors we can use dry needling to help solve some of the soft tissue issues with a lot of musculoskeletal injuries. And then did we do any soft tissue? Did we do any soft tissues with the muscles around there with our fingers?
Yeah.
Yeah, so we were doing some dry needling, we were doing some soft tissue. So basically what we did was we improved how your jaw was moving, right? And then you came back one other time, and a couple times, 4 times in 21, and I don't remember what that was for, but...
My TMJ was active.
So
so that second time is when you started with the dry needling.
The dry needling, yeah. So what brings you back this time?
Oh, just tore up in a different way. My back, my upper back.
Your upper back, okay, all right. So had you tried anything for the upper back prior to coming here?
No.
You just came straight here. Okay, all right, great. So let's have you face the camera. Go ahead and turn your head. No, you can just look at Carly. Turn your head to the left. Does that bother you at all? No, and turn to the right, all the way as far as you can go. Does that bother you at all? And now bend, look up at the ceiling, bend backwards. Does that bother you? And now bring your chin to your chest. Does that bother you?
No, but I can feel that it's very tight.
Up in here and through here?
All the way down there.
Yeah,
It's like,
okay, all right.
like 2 belts.
Yeah, so Alicia came in on, was it on Tuesday? Yeah, so one more thing. Let's have you bend side to side for me. I want to see how you move down there. Yeah, see, that's really good. Now go back the other way. Okay, and go back to the right one more time. And back to the left one more time. Okay, let's have you lie on your left side down and face the mirror that way for me.
Can I say something?
Yes, ma'am.
So when I do this,
Yeah.
all that hurts right up in there.
Yeah.
But when I do this, it doesn't feel as bad.
Yeah, that's why we're taking that side first, because there's a limitation in how you move. That's how we decide what we want to adjust first, no pun intended. So go ahead, lie with your left side down and face the mirror. And lean back in. So what's the significance of those shorts?
At the time when I bought them, probably about 7 years ago, they were on sale.
But you have a Star Wars shirt on and it looks like a SpongeBob pair of shorts to me, whoever SpongeBob is.
Yeah, no.
And I don't know, I don't know who SpongeBob is. Let me have this on.
Okay, I'm not gonna judge. I am gonna judge. How do you say words that don't know?
SpongeBob?
Yeah.
Well, I think that my grandchildren talk about SpongeBob, I think. So let's get you nice and loose. Take a nice breath in and relax. Let that loose. Very nice, very nice. Go on inside. Is that comfortable?
Yeah, I needed to let that sit in for a second. Okay, that's really good.
So the treatment is an adjustment, but we also did some dry needling up on that upper back, didn't we? Come on over here for me. Like this. So just relax. I'm going to roll you towards me a little bit, okay? Let that loose for me. Beautiful. We should have put a mic on that. That was awesome. On your back for me.
It was awesome.
So now we're going to adjust our hips. Relax your hip. Beautiful. Go ahead and slide back up that way for me.
I was told previously that they're uneven. I don't know how true that is. But.
Yeah, I think there are people who have, slide up again, so this one's a little bit more stuck in the other one. So what I want you to do is I want you to hike up your hip towards your shoulder, lift it up towards your shoulder. Nope, like this. Draw it up this way, like that, okay? Now draw. There you go, just like that. Hold that tension. And relax, just let it loose. I'm just going to give you a little tension on it.
Okay.
No, let go. Now draw it up. There you go, beautiful.
You know what, this feels like I'm holding a fart that I don't have.
Yeah, now go like this. Let it go, would you relax that? Now let it go. There it goes. So that's a little proprio facilitation to get that to move a little bit. So lift your head up for me, please. And you can slide and put your head at the top of the table.
Okay.
Not so far. Right like that. There you go.
Okay.
She has mid back pain, and yesterday, see, that's not as tight as it was the other day, but it's still tight. Drop this shoulder. That's beautiful. That's comfortable, isn't it?
Yeah, interesting.
Yeah. Good step off and go ahead and face one more time. Now let me see you turn your head to the left as far as you can go and to the right as far as you can go. Yeah, that's beautiful. Go the other way. Oh, that's really good. Now bring your chin to your chest. Has that changed out at all?
Yeah, there's no more tension.
No more tension, yeah. So we're going to go out into the hallway, and I'm going to use that technique that I did the other day where I push down in here, right? Yeah, so let's go ahead and do that again. We won't go the hallway. On your tummy. Again. Do you work out? No?
My idea of working out, I walk a lot.
You walk a lot. It's probably one of the best activities you can do. And go ahead and slide up for me a little bit. All the way up. Yeah, now relax your arms down. I think when we talk to people, young people, they're not quite there for the most part, but we talk about living better longer, right? And there's different components of that. One of those is movement. And the way we take movement, we divide it into two categories: cardiovascular fitness and strength training. So you're never too young to start on a program like that. And walking can be an introduction into the cardiovascular fitness, especially if you walk for 45 minutes or so. See, this area, what we're doing is we're walking up her spine in each segment at a time, and I'm looking for those areas that are not moving properly, and there it is right there. That's stuck, if you will. So take a deep breath in, breathe all the way out, let it loose. Okay. Was that uncomfortable?
No.
No, that's standable now. I'll do one more thing. See, bring your chin to your chest for me again. How's that now feel compared to when you first checked it?
Much better.
Much better.
Even the last time, I felt some weird pain at the center. I don't feel that.
Feel it right now? Yeah, okay. Okay, so what we're gonna do now is we're gonna go dry needle, and we actually put class 4 laser on there, which I think is really a powerful tool for this kind of condition, okay? So anything else you wanna share with everybody out there?
Get it together.
Yeah, good. Thank you, Baltimore. Carly, if they like this, what do they do?
Subscribe.
Subscribe. And if you're have any pain between your shoulder blades, give us a call at 410-296-7700.
There you go.
How am I doing with that, Carly?
Getting better.
Better. Thank you, Baltimore.
Well, most recently, I guess around September last year, on vacation,
Right.
I had a reoccurrence of the lower back pain, which when it hits, it's very painful, and it can actually knock you off your feet.
Prevent you from playing golf?
Yes.
Okay.
And it didn't go away. Sometimes it goes away within hours,
Right.
but this time it didn't. It persisted. So I called you and made an appointment when I got back from vacation to start an adjustment cycle.
And that was back in...
That was probably October.
October, right.
And it hasn't reoccurred since. I feel great.
So if you came to us about more than 14 years ago, did you come to this office or one of our other facilities?
No, it was the same, this office, yes.
And so since that time, this office has been transformed about 2 or 3 different times.
Yes.
So now it incorporates the traditional chiropractic treatment, but since then we progressed to more physical medicine. So we always talk about feel better faster. And,
Yes.
And we've done that again,
Yes.
right? Do you feel
Yes.
better?
I feel much better. Yeah, both physically and mentally.
Mentally.
Yeah.
Yeah. So then we went on to the second phase of what we do is get stronger, smarter, and sometimes we call that the functional strength program,
Yes,
right? Yeah.
yes.
And so, how long have you been doing that for?
Well, I guess I'm going into my 3rd month of that now. I think it's been at least a couple of months.
Yes.
Twice a week.
Right.
The functional strength program,
Right.
the personal trainers who are wonderful.
Yes.
I have so much knowledge in them, plus they're fun to work with. And I feel significantly better. I have more flexibility.
Mm-hmm.
It has probably more strength in my legs, especially.
Yes.
And upper body. It's helped my golf game, quite frankly. All right. So I'm.
Is it low? Have you put enough scores in to see what has it
I have.
changed your changed your handicap?
I have. I'm honestly playing the best golf. I'm 78 years old. I'm playing the best golf I've probably ever played. Now it's a combination of a lot of practice and some instructions from the pro.
Yes.
But there's no question but that the functional strength program has helped me with strength and conditioning.
Yeah.
I'm in better shape when I'm playing golf, which is very important.
Yeah. So before we started the functional strength program, were you getting instruction then?
I had.
Were you practicing then?
I had both. I had taken a couple of lessons on my swing and my balance, and that significantly improved my my game as a result of practicing that. And I've played a lot in the last several months and worked on it. But I think in terms of my hip rotation and general in shapeness, being in shape, if you will, has made a substantial difference, and I think that it's clearly showing in my golf game.
So you're less deconditioned, really?
I would think so. I would think so, because before I started the functional strength program, I was kind of tired. Kind of like I'm walking the course, okay?
Yeah.
And with carrying a bag. So my legs are in better shape, and I really I wasn't able to do that with the ease that I can do it now.
Yeah. So what we're getting down to is I think what motivates a lot of people to come to the office is they have some sort of musculoskeletal condition, and there's some other things that many people have too, like a headache or things along those lines. So that's what generates them coming to the office. Mm-hmm. But then the office is not only is the physical space has gone through a transformation because
right.
the way we practice has been transferred from getting people to feel better faster to get them to be stronger. And as part of that comes from the concept of living better longer.
Right.
Right.
Correct.
And to me, that if I was going to have a chapter, the first chapter would be sleep. The second chapter would be movement, and movement's broken into two sub-chapters, and that would be cardiovascular fitness and strength training, mm-hmm. right?
Right.
And then the fuel you put in your body would be the third chapter. Then I think everybody needs a sense of purpose.
Right.
And they also need to learn how to manage the stress that's out there in life. But I think if you take care of the first three big ones,
right.
the other things, it's a lot easier to deal with those, right?
I totally agree.
And there's things underneath that go along with that, having the proper supplements, the proper medication, getting adjusted periodically, those
right.
kind of things. So it's made a difference.
Mm-hmm. It's made a significant difference. As I said earlier, both in physically, I feel better. I feel like I'm in better shape. But also, it's mentally. It's just a. I was never a person who was depressed. I'm a very upbeat person. But the physical improvement has just made it's just more fun getting up, and I've made a commitment to myself that I want to keep this up for the rest of my life as long as I can keep doing it and playing golf.
So the other thing that we're starting to do is we're starting to waken up some habits that are probably really productive and good for you.
Yeah.
That is the movement part of it.
Yes,
yeah,
yes,
yeah.
Absolutely.
So that's great. Anything, and the other thing is, not only have you had a chance to see me,
right,
but this is another way the office has changed.
Right.
We have 5 different practitioners in here, both male and females, mm-hmm. and you've had a chance to see Dr. Angie.
Right.
You've had a chance to see, did you see Brady?
Dr. Brady.
Dr. Brady, yes. Right?
And you, and the 3 of you.
3 of us, 3 out of the 5, right?
Yes.
And so what's really nice about that, it's a team that helps you.
Yes.
It's the doctors and it's the chiropractic assistants doing the strengthening program.
Yes,
right? Yeah.
Yes, and every individual, I'm very pleased with the support they've given me, with the care they've given me, and just the personal touch. Great bedside.
How's the front desk with you?
Front desk is outstanding.
Yeah,
they're very responsive. I can get an appointment on short notice, so I couldn't say more about the front desk. It's excellent.
Yes. So this isn't just true for golfers. We love taking care of golfers because I think we all play golf, right? To some degree or another, right?
Right.
But if you're looking for something to help you live better longer, all this takes place under one roof, right?
Yes.
And not only do we have the strength and conditioning folks, we have a nutritionist on staff, and we're bringing in a nurse practitioner just to expand our services. Mm-hmm. Anything else you'd like to share with everybody
I just think I would reiterate what you said, Dr. Jeff, that I think it's one-stop shopping, okay? And that's essentially what you described.
Yeah.
And it's very convenient. I live in Lutherville. It takes me 10 to 15 minutes to shoot down here. Easy parking, and then I have all the workouts that I need, all the equipment
Easy parking
in one
here.
place.
Easy parking.
It's a real plus.
Right, yeah, it's a big plus, yes. Thank you, Baltimore.